Welcome to Viva La Visionary, the podcast that celebrates the innovative ideas and mindsets of entrepreneurs and visionaries. Join your host, Coach Bob Schittefeld, as he dives into inspiring stories and practical insights from trailblazers who are changing the game. Whether you're an aspiring entrepreneur or a seasoned leader, this show is your source for motivation and creativity. Let's embark on this exciting journey together.
Hi there, Coach Bob here. Excited to have another edition of Viva La Visionary, our podcast for visionaries, celebrating and elevating the visionaries. And I'm very excited to have my good friend and family confidant, Dr. David Brownstein. Dr. B, how are you today?
I'm doing great.
Good. And I'm fantastic. And looking at your shirt, I'm sure you're doing well from over the weekend.
Very happy. Nice big win over Ohio State, 4 in a row. I don't think we're ever going to lose to them again.
I appreciate that. And my daughter, as you know, goes there. And obviously your two daughters went there. So I'm a Blue fan as well, but also respect everyone, but love that win on Saturday. Well, cool. Well, thanks for being here. So I want to hear, and ask you questions about your thoughts on health for sure, but also especially around being a visionary. And so do you consider yourself a visionary?
Well, as you know me well, I'm not the most comfortable tooting my own horn, but
Yep.
The answer is I've heard you talk about visionaries, so yes. I have a holistic practice in West Bloomfield, Michigan. I'm honored to do what I do, and I'm honored to be Coach Bob's doctor. And his doctor.
I'm very grateful.
Doctors. I didn't start off this way, and I started off as a conventional doctor. Also, I wanted to be a doctor my whole life, and I didn't know anything about holistic medicine, and I didn't grow up in a household where we took supplements or we didn't do anything different than what doctor told you to do. We went to the doctor when we were sick. We took whatever they gave us. We didn't question anything.
Yep.
And we didn't take a vitamin in my household. We didn't pay attention to the food we ate. We ate whatever we wanted.
Right.
Quarter pounder with cheese and large fry and large Coke was a pretty staple with me in high school. Haven't had one probably I don't even know now. Over that 35 years, something like that. And so I went to med school and wanted to model myself after my family doctor. I had a severe case of asthma growing up, so I did go to the doctor a fair amount as a kid. And I had a bunch of emergency room visits from status asthmaticus or severe asthma attacks where I couldn't breathe.
Right.
And I figured when I was in med school, I kind of knew how I was going to die. I was going to die, breathless from asthma. And so I went and began practicing regular conventional medicine as I was taught. I never deviated from it. I bought into all of it. And what I was taught in medical school was to diagnose pathology and prescribe the one drug to treat that pathology. And I thought there was a drug to treat everything. And I thought science was the king of kings. And, I bought into what I was taught.
Right.
So my turning point came about 6 months in. I'm getting to this visionary thing.
Yep. No, I get it.
My turning point came around 6 months into practicing conventional medicine as I was taught. I would tell people don't take vitamins. It's going to give them expensive urine. They're wasting their money. I told my mother-in-law that from meeting her on day one, and she never let me forget that. Trust me.
Right.
And around 6 months into practicing medicine, I lose sleep for about 3 nights in a row for an unknown reason at that point. Everything was fine. We had a baby coming. My wife was very pregnant at the time. I was negotiating and buying for a partnership in this conventional practice. I was making money. I was busy. My practice was growing. I thought that's where I needed to be. And after the third night of not sleeping, we're getting up, Allison and I getting ready to go to work. And I said to her, I blurted out, I don't want to be a doctor anymore. Now, we had $100,000 in student loans at the time. She met me at 18 years old at the University of Michigan orientation. We were together since then. It's all I ever spoke to her about was being a doctor. I had no plan B. It was a calling. It's still a calling. I never said a word to her before about it. I was unhappy. And she goes, you got to be kidding. She goes, what's wrong? I said, I don't know, but I'm not helping people. She goes, why not? I said, because all I'm doing is treating them with drugs. The drugs aren't treating the underlying cause of the illness most of the time. And I'm having to use more drugs to treat the side effects than the first drugs. I said, I can't do this for the next 3 or 4 decades. And she said, what are you going to do? And I said, I don't know. Now, as I mentioned to you, we had $100,000 in student loans. We had a baby coming within a month. I had no plan B going on. So I went to work that day, and one of my patients in the morning was a guy my age whose wife worked with my wife, and they drove to work together. So we had done something socially with him, and he was bothering me for a while to meet his chiropractor. Said his chiropractor really helped him. And it wasn't just adjusting him, he was doing a lot of supplements with him.
Right.
And he said the chiropractor changed his life.
Hmm.
Now, at that point in my career, never met a chiropractor, didn't know what they did, didn't know the philosophy. Yet I told people don't go, they're dangerous.
Right.
And that's what I was taught. I wasn't taught anything formally about that, but that was whispered to everybody in medical school. And so in my anxious, insomniac state, I took that phone number from him that day. At noon, I called that chiropractor, and he answered the phone, and we picked up a time to meet for dinner. 2 nights advanced of that.
Right.
So that night comes, and I get home from work. I said to Allison, I'm going to cancel that dinner. What am I going to learn? It's a chiropractor. It's a waste of my time.
Right.
And she said, too late. That would be rude. And as I walked out the door, she told me to be nice. And I went to the meeting, driving there thinking this is a waste of my time. I get to the meeting. His name is Dr. Robert Radke. We hit it off right away. He's a nice guy. He was super smart. He started talking to me about what he was doing, what the chiropractic philosophy was, and he was talking to me about functional biochemistry. Now, to get into medical school, you take biochemistry. I took biochemistry at the University of Michigan, the defending national champions for a few more weeks, and the winners, 4-time winners in a row of beating Ohio. And I got an A. I took the same biochemistry course, pretty much the same course in medical school. I got an A. I thought I knew biochemistry. I didn't know biochemistry. Dr. Radke knew biochemistry. Now,
Right.
I could get A's on the tests and in the course, but they didn't teach us functional biochemistry where you could apply it to the patient in front of you. Dr. Radke was actually doing that. At that meeting, my head was twisted 180 degrees.
Right.
And I couldn't believe it. I mean, why wasn't I just graduated from my training, my residency training? The knowledge was there. I was right,
Right.
I did well in all my tests. I did well in my board tests, and I knew what I was doing in conventional medicine. I didn't know any of this stuff. And I thought he was the smartest doctor I ever met. I still think he's the smartest doctor I ever met.
Yeah, he's awesome. Right.
We became great friends, and we shared patients. And he brought me a book at that meeting called Healing with Nutrition by an allopathic physician, Dr. Jonathan Wright. I took that book home and I read it till the middle of the night. Now, I hadn't slept for a few nights before that very well. And I was jacked. And I read that book till 2:30 in the morning. I get up 5:30 to get ready for work, my conventional practice, and adrenaline's going, and I'm still jacked up about this and excited. And I called my dad before I left for work, and I said, hey, Dad, can you stop in the office and draw some blood tests? So I drew 2 blood tests on him based on what I talked with Dr. Radke about when I read in that book. Because I was focused on that book on heart disease, the chapter on heart disease. The reason was my dad had his first heart attack at 40, second heart attack at 42. Over the next 20 years, he had 2 bypass surgeries, numerous angioplasties. At that point in my life, he was on 12 medications to treat diabetes, heart disease, and hypertension. He was having continual angina for 20 years. He was taking nitroglycerin pills like they were candies, little mint candies.
Right.
And every day he was having chest pain. He's popping nitros, multiple nitros a day. And he looked terrible. He was all pale and pasty. And I was waiting for the phone call that he died. We were all waiting for the phone call. So I drew 2 blood tests on him. I drew his thyroid levels and a full thyroid panel, which was much more extensive than what I learned in medical school. And I drew his testosterone level, which nobody bothered to check. His levels come back, his testosterone level is 0 or below detectable limits on the lab reading. And his thyroid levels are in the reference range, but in the low part of the reference range. So I put him on 2 things, natural thyroid hormone and natural testosterone. Within 7 days, his 20-year history of angina went away, called me up that day, said, hey, I didn't use any nitros today. When's the last time that happened? He goes, I don't know. We traced it back to when he started having chest pain, which was 20 years ago. And 30 days later, his cholesterol stuck in the fridge before this was below 200 without changing any of his bad dietary habits, and my dad could eat like the best of them. And once I saw the changes in my dad, he looked, instead of pale and pasty, he looked pink. He was doing things outside now. He was, feeling better. My parents' friends were asking my mother, what are you doing? He looks way better. They wanted to do that for their husbands.
Right.
And I saw the changes in him, and I knew that's what I wanted to do in medicine. That's where that vision came from. And I went to the partners right around then and I said, hey, I had a lawyer. We were negotiating a buy-in for a partnership. And I said, I don't want to be a partner anymore. And they're like, what's wrong? And I'm like, well, I need to leave the practice. And they said, why? And I'm like, I'm going to go do holistic medicine. And they said, what's that? And I said, I don't know, but I'm going to have to figure it out.
Right.
And they said, why don't you just do it here and figure it out here? And I'm like, no, I need an office where we're all together. We're all in the same energy path. We're all in my file clerks, my people answering the phones, my nurses, my other doctors, whoever I'm working with.
Right.
We're all trying to accomplish the same thing. The energies, I felt like I wanted everyone in the office on the same plane. And at this point, this baby is coming. He was term at that point, and right when I left is when we had that baby. So, that's how it all started. I am now 30 plus years later, still my calling in medicine. I wouldn't change a thing. The only thing I might change is I kind of wish I would have had my leadings a little bit earlier in med school, but beyond that, I wouldn't change a thing. I think I have a better idea what holistic medicine is now.
You do.
And but I'm still learning and still refining it, and it's a good ride. So as far as a visionary goes, I knew that vision could not be accomplished in that office. I didn't know what I wanted. I did have that vision of an office where we're all together.
Right.
I just didn't quite know what we were going to do or what it was going to look like or how it was going to be, but I knew what I needed. Looking back on it, some people have asked me like, weren't you scared? You got a baby coming and $100,000 in student loans. I didn't come from a wealthy family. We didn't have money to lean on. And I remember talked about it with Allison, and she never gave me a hassle about it. She's got the best wife in the world. And I said to her, there'll be no worries. I can work in the emergency room at nights if I have to, weekends. I was moonlighting a little bit then to make some extra money. And I said, I could do 2 jobs if I need to. And then I just did it. And I found a new office, started practicing holistic medicine. I put the energy out there. That's what I wanted to do. And those are the patients that started coming to me. It was really interesting how it all kind of manifested itself. And, it's like I was walking down this pathway and I just turned around here and started walking down this pathway. And it just followed me. And it still followed me. And it's great.
You and I haven't talked about what is a visionary and who is a visionary, but I know you are. And so pretty much everything you just described is what a lot of us visionaries, we see an opportunity. If it ties in with our passion, especially, we have a vision of kind of what it could look like. We don't know how necessarily, but we have the courage to go do it. And the courage to face adversity of either cash flow or our spouses or what people are going to say about us. And you've been a shining example of what a great visionary is.
It's when I was raising my kids, I remember telling them, if you can find your passion in life, you'll be ahead of 95% of people out there, 95+% of people out there. And I said, if you can find your passion in life and make a living off your passion, you're going to be ahead of 99% of people out there.
Right.
I said, look, even if you find your passion and perhaps you can't make a living out of it, you can still do that somewhere in your life and make a living. Sometimes you got to make a living doing some other things. But I said, people like to be around other people who have a passion for something. They feel it, and we all like that. And it doesn't. I don't even care if you're. I don't care what you're doing. I don't care if you're working on an assembly line. I don't care if you're digging ditches. I don't care if you're doing neurosurgery in someone's brain. If you have a passion for that job, you're gonna dig better ditches. You're gonna do better neurosurgery, and you're gonna do better whatever it is. And people are gonna want to hire you or be around you because you've got that passion. And I'm thankful I found it. I'm thankful I found it. Thankful I acted upon it.
And I'm thankful for what all you've done for me and my family and the rest of the community and a lot of people throughout the world. And it's fascinating. And I'm so proud of you that now you were about to have that baby how many years ago. And now that baby and your other baby, your 2 girls, are now working at your practice. That's got to be heaven.
It's the best thing in the world. I got one daughter. My daughters both had always talked about going to med school, and we all talked about working together. I never forced them.
Right.
And there was a little rough patch with one daughter in undergrad. She wasn't sure she was going to get the grades to get into med school for just a short period of time. Why'd you force me to do this? I didn't force you to do anything. And she ended up doing it, and she's doing fine. And I have, when they came into practice, I moved everybody away from me a little bit. So one could sit here and one could sit here. And, it's hard to put into words how cool that is.
Well, and I always wondered, what's your succession? And now you've found it. So I want to share how we came together. We went to, actually, it was where I used to get my hair cut. He would put on a health seminar, and your partner, Dr. Eng, was speaking. And so, Cheryl, my wife, was holistic anyways, just in her nature. And so we went to see him speak, and we read about the author on one of your books. I coached my girls' soccer team and a couple things. And Cheryl's like, this is your doctor. I'm like, okay, whatever. And I just, on the health side, I do whatever she tells me pretty much. And then when I came to see you, Cheryl was going to come with me, but she couldn't because Grace was just born recently. And so she couldn't leave her at home. And it was just, okay, fine. So that's now 23 years ago. And I came in to see you, and I had a thyroid issue and a couple other things. And I asked you, I said, do you mind if I put my wife on the phone? And you're like, absolutely. And you spent literally 45 minutes with me as she was asking questions. And I'm like, I know you got to go and you're busy. He's like, are you kidding? A patient that actually cares about what they're doing, wants to learn and wants to make their own decisions. That was amazing. And then the two of you talked, and then you wrote 5 books together. So
we did, and we've become good friends, and all 4 of us are good friends.
Yes.
And, it's been,
That's awesome. And also another thing, and again, when you were describing all those things, you are a visionary, and even a visionary often creates a culture of who they are and it's almost like a craft. I call it craft is basically teaching what we're also learning. So again, you put yourself through it, and it's like, hey, this works. And then, other people came to you. And when I first came to your office, there were paintings with different colors from your daughters. Where's your artwork? And I love that. And you had a great atmosphere, and you have so many different modalities and around the natural things. And I know when Cheryl came to shadow you one day early on, she was like, I'm a little disappointed. And I said, well, what do you mean? She's like, well, he says the same things to people, and it's so simple. I'm like, well, what is it? Well, drink more water, take Celtic sea salt for minerals and help you to absorb the body. Don't eat white sugar or white flour. Detox and sweat. And if you do those things, it takes care of 80% or whatever the number is. And yes, there is a time and a place for a surgery or a drug, but you look at the natural way and how I heard you say it, like with my thyroid, I was taking a medication that was basically boosting up parts of my thyroid. So then the other parts were like, well, I don't have to do my job with the simple either hormones or with the different remedies and whatnot, that it was helping to build the thyroid up and help the body to heal itself. And what a simple concept. And so I appreciate, and also one other thing about that, I love coming to your office and hearing people just like, I had nowhere else to go and no one knew what it was. And I came here and he could help diagnose it. And part of that's the blood work that you do. And just how you look and diagnose is amazing. But you've helped so many people who are desperate. So just so appreciate everything you've done.
Let me tell you. And I told my girls, one of the graduations from med school, the dean at the graduation said to them, medicine is like a mistress. And he said, it's going to take a lot more from you than it's ever going to give back. And you may lose your spouse or your fiance. You're going to have a tough marriage over it. And it was very negative about everything with medicine. And I'm sitting in the audience with my other daughter and my wife, and I'm like, that's not true. That is not true. That's not true. That's not true. I said, and I told my girls, medicine is really difficult. It's very stressful. Many 2 a.m., 3 a.m. in the night, pacing, thinking about a patient, thinking, are we on the right path? Should we choose a different path? Should I have diagnosed this earlier? Should she be on this medication or that? Whatever, whatever it is. When something is maybe not going in the direction I wanted to go, we both wanted to go in. And I said, it's very stressful, but I get way more out of it than what I put into it. And it's my passion, and I wouldn't change a thing about it. And it's worth those 2 a.m. pacings, and it's worth the stress. And, look, I've had some issues during COVID with the, Board of Medicine, coming down our throats because I was promoting, you can do natural therapies. You don't have to do all the time.
Right.
We're talking about. And I wouldn't change a thing. It was just, it's been a good ride. And I told my girls, look, if you're going to it for the right reason, and the right reason is just being there for your patients and really being an advocate for them, it's perfect. And it has been perfect.
Oh, that's awesome. So one thing you and I haven't spent a ton of time talking about is what effect does stress have? So for us visionaries, there's a book by a psychologist, Dr. Doug Brackman. It's called Driven, and he has done a lot of studies and say that 8% of people are driven, and they literally have a different gene makeup And we have addictive personalities, and a lot of us have imposter syndrome. So we're trying to prove ourselves every day. But a lot of us driven visionaries, sometimes we forget about ourselves with our relationships, with our health. So how much would you attribute some of our health issues or non-issues to stress?
Well, look, at 2 a.m., 3 a.m., when I say I wouldn't change a thing, sometimes at 2 a.m. or 3 a.m., I'm thinking, what the hell am I doing? And, there's been moments where I've questioned,
Right.
is this all worth it? And it is. But stress, I always tell my patients, you don't want a doctor who doesn't deal with stress or doesn't feel stress. You really don't want a doctor who doesn't have a little bit of OCD in them. You don't need to look, if there's no stress and no OCD, hey man, whatever. Your labs are off. Well, you know what? Let's just go smoke a joint and see how it goes.
Right.
And you want a doctor to be paging through those charts and thinking about it, going back once in a while. There are some nights when I've come back to the office at 11 o'clock at night because I can't sleep,
Right.
thinking about what is wrong with this patient. What are we missing? They're like sick or they're in the ICU or something. And so I think that to a point, stress can be beneficial. If we're, the fear of failure can be beneficial. You sort of mentioned, what was the term you just used about,
Oh, imposter syndrome.
imposter syndrome.
Yeah.
Every fall I got the same dream, and the dream is, I don't get it as frequently as I used to get it, but the dream is that I'm going to work. A letter comes to work saying, you missed a class in undergrad and you have to take this class and you have to pass it, or everything crumbles. Your degree is going to be taken away. And so it was nothing to do with medicine. It was some class,
Right.
and it was I don't remember. It's some like poli-sci or history class or something like that. And so I buy the book for it and I sign up for the course, and then I don't go because I'm busy. I'm busy seeing patients, and I keep saying I'll read it tomorrow, I'll go tomorrow, or I'll go to the next class. And the semester goes on, and I'm not going, I'm not reading the book, and then the final comes. And what happens with me is the final's there. I could feel the anxiety bubbling up in me. One of two things happens here. If I'm open the door to go in the final, it's almost like that risky business.
Right.
Risky business when he's looking for the SATs.
Right.
And I open the door for the final and I sit down and it's like written in Greek. I can't read it because I didn't study the material. And at that point, I wake up in a sweat and I'm panting.
Right.
And I have to think to myself, wait a minute, how old are you? You're done with school. You don't have to take that class. And if I did have to take the damn class, I would have studied for it and I would have passed the class.
Right.
Because that wasn't my style back in the day. But so I still, that imposter syndrome still in me. Maybe that's still what drives me a little bit too. Because I used to feel like a little bit, when I was younger, I felt like a little bit of a fraud. Like I'm the kid from Livonia. Just how did I become a doctor from this,
Right.
school in Livonia that, I was a high school kid, like we're all high school kids, how did
Right.
I get to this point? And, then gradually it is kind of cool because I've gotten older, I've accepted it and and then, Dr. Radke helped me with that actually. So I had this dream. He was big into dreams. He used
He
to
was.
interpret dreams. You
Right.
remember him.
Yeah.
So I called him up one day and I said, Rob, I had this dream. I said, he goes, tell me your dream. Because I said, I know it's a big dream. I just can't quite get my brain around it. So my dream was, back then I was writing books and I've written 17 books.
Yes.
And when I was younger, I used to go in the early fall and early winter when all the conferences were. I'd be going off. I'd work Monday through Thursday. And Thursday night I would fly somewhere, lecture Friday, and come home Saturday. And I did this probably 2 to 3 weekends a month for 2 months or so every fall and winter. And it was a lot, but I was young. I was working full time. We had little kids. And it was okay. I was enjoying it, I thought. I mean, it was.
Right.
It wasn't just part of the job. So this dream came one night in the middle of this, that I was sitting in the back of the plane, and I was fine. I was going to some lecture, and the stewardess comes up to me and says, "You're in the wrong seat." I said, "No, I'm not." And I show her my boarding pass, and she goes, "No, you're in row 2A or something like that, first
Right.
class, way." And I said, "No, here's my seat." She goes, "No, you're in 2A. You need to move your stuff. Follow me." So I'm sitting there and I'm like thinking to myself, well, I don't really need to leave. I'm fine right here. I was in the very back of the plane.
Right.
And so she comes back and says, I need you to come with me now. So I pick up my stuff. I move up there. I sit in the seat. I had never sat in first class at this point. And on my left, I'll never forget it, in the molding of the plane, something was sticking out here, like a plastic piece. It was part of the plane, and it had a little jag to it like this. So my head in the seat was like this. So the whole plane ride, well, I sit down, I'm like this, and I'm thinking, this is really cool, the seat is really nice. And then right before they close the doors, this big fat guy comes and sits next to me over here. And his fat is hanging over into my chair. And so my head's like this, and then he's coming over, and I'm like this now.
Right.
My head's really crooked. And plane takes off, and I figured I could feel the anxiety coming. I'm starting to get a little uncomfortable. And then I wake up, and it's time to wake up. Well, I wake up with this neck pain slamming down my left side of my neck, and I remembered that dream like it was vivid in my brain. So I went to work, and my neck's killing me, and I'm just like, so Rob, the chiropractor,
Yep.
was, I could call him, and I'm like, Rob, I need to see you. I got a bad neck pain, and I had this dream. So I come over his house. He would do house calls. The house calls was you come over to his house,
Right.
and I tell him about my dream, and he goes, this is everything for you. He says, and I'm, at that point, he was always fired above me, and he goes, "Do you get your dream?" And I said, "Well, this plastic piece is sticking out here. My neck hurts right now, And he goes, "No, it's much more than that." And he says to me, "There's two parts to this dream." He goes, "Number one, who's the fat guy?"
Huh.
And I'm like looking at him with puzzled eyes, and he goes, "The fat guy's you." And he said, "Was the fat guy uncomfortable in first class?" No, and I told him this. I said, the fat guy, as soon as he sat in the seat, fell asleep.
Right.
With his fat hanging over me, and he was comfortable in the sleep, and I was like this, And he said, so the fat guy is what you want to be, where you just enjoy, and you can fall asleep, and you can rest, when you need to rest, and everything's good. And he said the other part of the dream was you need to be okay with moving to first class. It's okay to sit up there, because I never did that. I
Right.
never did that.
You're very humble.
And at that time with him, when he adjusted me and he adjusted my neck and it felt better after he adjusted me, we were talking, and I was complaining to him that I don't mind mowing the lawn and trimming the lawn and all that stuff. I said, the problem is the time.
Right.
He goes, what do you mean? I said, well, I like writing books, and I don't know how many books I had at that point. I said, I'm just having trouble, finding the weekly time to mow that lawn. We had an acre. Took a couple hours to do it. And I liked it. I was outside, and, I'm an active guy. I didn't, need a lot of sleep. I never have. But I was finding time mowing the lawn. He says to me, that same visit, well, some people make their living mowing the lawn. Why are you taking their living away from them? And I looked at him and I said, well, I never thought about it that way. He goes, you make your living writing books and seeing patients. Why don't you let them make their living mowing the lawn? So, I left that meeting. My neck was feeling better,
Right.
Got all these things to think about. I come home and I said to Allison, I'm not mowing the lawn anymore. I'm not changing the oil. I'm not fixing the brakes. I'm not shoveling the snow. We need to hire everyone to just start doing all this stuff.
Right.
And she says, are you sure? Because I grew up in a household where there wasn't a lot of money, and my dad taught me to do everything, and you never paid anyone to do anything you couldn't do.
Right.
That was how I was raised. And I decided that I was going to be okay with sitting in first class, which I am now.
Yep.
And I do like it a lot better. And I said I was going to allow people to make their living shoveling the snow and mowing the lawn and doing the brakes, and they deserve to make a living too. And I'm comfortable with it. From that moment on, I never brakes, changed the oil, stopped rotating tires, stopped doing everything. I did. It was a piece of me that kind of liked it when I had time, but
Right.
it was good, and it was a very big growth thing for me to allow myself to be okay
Right.
with first class and be okay with people mowing my lawn,
It's amazing what emotions can teach us. And so that's very cool. You're able to tap into that. And we call that in the business world delegating and elevating. So you're delegating to people who are better at it and more effective, and you can elevate to a higher consciousness and affect more people and whatnot. So you did that even unknowingly, not knowing it was called delegate and elevate.
Yep.
So you mentioned you write books. How many books have you sold so far, approximately?
I've written 17 books.
Right.
We've sold, I stopped counting, but we're well over 500,000.
Right.
It's probably over 600,000 or 700,000 at this point.
That's amazing.
And all about holistic things. And, people ask me, where do you have time to write these books? I'm like, well, I don't really consider it time to write a book. I kind of like it. Most of the time I like it. So I either write books for one or two reasons. I write about what works
Right.
and what doesn't work. I either write books for one, I become passionate about it and excited about it, the topic, or two, I become really irritated about it. And those two things fuel me to get the juices flowing to be able to put that time and energy into doing that. It's been a good part. It's been a good ride with that, where I can get my views known and my thoughts out there and help people at the same time.
Without having to see them one-on-one, which is amazing, right?
I love what I do. I told you that a few times. Right. It's a calling and all that. One of my favorite things, one of my best compliments that I will take is when I see somebody anywhere, either lecturing or just out in the world. People stop me in airports and said, I read this book. It changed my life. I did this and made this better, or my pain went away, or my brain fog went away, or, saved somebody's life. And I get a real kick out of that. I haven't met them, and they were able to gather what I said and then try it for themselves and see the positive results with it.
That's awesome. So if someone wanted to check out your books, where do they find it?
My website, www.drbrownstein.
And I don't like detailed, intense books. Yours are very simple. They make sense. So, kudos to what you've done for all that. So I have two questions for you before we wrap up. One is, what's the biggest issue you're working on or opportunity, either in your business or in your life, that you're working on next? What's the one thing that is, again, we call it an issue, but an opportunity that you're pondering right now?
Well, I think I shared with you, when this is December 2nd of 2024. So we had a presidential election 3 weeks ago, and, Trump won a second time. And, Bobby Kennedy, who I've been friends with for over a decade, hopefully going to be Secretary of Health and Human Services, which sits over FDA's NIH, National Institute of Health. And what I hope is that he can be the catalyst for change coming to our country, where we can stop our reliance on these toxic drug therapies that are basically, drug therapies work with two mechanisms. They poison enzymes and they block receptors. And in an acute heart attack or an acute stroke or something like a car accident or something terrible that happens, surgery can be just life-saving and wonderful. People don't die as much from heart attacks and strokes, and they're not as affected by heart attacks and strokes, the broken bones and from car accidents and stuff, because we're better at treating these acute situations. Where we're not better is treating chronic illness. And over 70% of Americans have a chronic illness, and we're terrible at it. This long-term care, people aren't healthy, our food stinks, our water stinks, and, we need somebody who can make America healthy again. And Bobby Kennedy has been promoting this for years, and I'm a friend of his, and I'm a big supporter of his. And so I want this to move forward, and I hope to be an advisor to this group to help them with this, and to help our country move forward with this, because this is crucial, man. Our kids are sick. Nearly 70% of Americans are overweight. Over half of adults are obese. Nearly half of adults are obese. We have obesity in our kids. We have diabetes now in kids that was never there when I was a kid. We have a mess on our hands. We don't survive as a country the way our health is going right now. Our day of reckoning is coming, and either we make a turn, we turn this ship around, or I fear for what's going to happen. So I'm hopeful and I'm positive, and I think Bobby can do this.
Oh, I love that. Well, good luck with that, and we're rooting for that, as we've been obviously on the natural path, and people used to make fun of us, and yet they keep saying, how come your kids don't get sick that much? And boy, your kids seem alert, and wow, how come? And it's just like, and again, fortunately, Cheryl was a staunch believer in natural things, and the fact that you work together, and it gave her confidence to raise our kids in a healthy manner. And again, it's not stuff that we have to go to people. We can do a lot of this on our own with drinking more water and sea salt for minerals and not eating white sugar and white flour. And I know Cheryl used to do a class at Whole Foods. And if you read the instructions, you can't pronounce the words of the ingredients, and there's 50 of them. It's probably not natural. So I mean, just the simplest things like that. So we appreciate that. So what's one thing that what's one piece of advice or experience share you would give to visionary entrepreneurs? Again, as I told you, many of us are driven. We are up at night. We're trying to make a difference in the world. So whether it be health-wise or business-wise, what's one experience you would share with us as something you've learned that have helped you?
It was interesting for you to talk about when Cheryl wrote with me for a day and comment.
Right.
I haven't heard you say that before, so that was really interesting. And what I would say to the audience out there is find your passion. And people want to be around people with passion about something. If you could find that passion and that passion can help other people, go for it. And if the passion helps you, go for it. And so many people are just kind of muddling through life without passion for much. I think these are the people that are dulling themselves with all these medications and marijuana and alcohol and things like that out there.
Right.
I think life can be exciting and interesting and sometimes a little scary too. But man, if you find that passion, that's what drives people, and that's what other people are looking to be around. They can feel it coming out of you, and I think it makes people more successful and makes them better, whatever they're doing. And as I said before, Bob, I don't care if you're digging ditches. I don't care if you're whatever.
Right.
You'll be better at it. You'll be better at it. And I had a patient who got a business picking up dog doo-doo. And just had the idea, form a business with it. He's got 4 trucks now. He's got people going out. He's hiring people to go out there, pick up people's yards. He charges them weekly and goes out there once a week. And he says to me, it's the best job in the world. I'm outside. I'm getting exercise. These people, some of them can't even do it. And he goes, they can have their dogs and still enjoy their dogs. And I can help them out with that. And I'm making money. And awesome. He's making a decent amount of money now. And he says it's a great job, picking up dog crap. And he's got passion for that.
Right. Passion is contagious, that's for sure. Well, and again, we call this Viva La Visionary, and my vision has been, again, as a kid, it was like, oh, there goes crazy Bob. He can't sit still, and and he doesn't remember details, and he's not always great at follow-up. And so I always felt that I wasn't smart. I did not like school. And again, I can sell and I can inspire. So I was always a successful salesperson for a company. And then I got so fed up with the culture of the company, I'm like, I'm going to go start my own. And so to have that courage to go do it is a huge thing. But there's a lot of us visionaries that we have passion and we start it, but often, to run a business, you can't do that. So a lot of us visionaries have kind of lost being ourselves, because we are the vibe and the energy of the business. And a lot of times we water down our vision. So again, in the community of entrepreneurs that we're a part of, our rally cry is Viva La Visionary. It's celebrate and elevate. And you've been a great example to me, not, a technical how to run a business, but you had a passion, you had a vision, and you made a business out of it, and you've created a life out of it. So I appreciate what you've done for the world and for me. And it's Viva La Visionary. Thank you very much.
To do it, and it's been a great road. And I wouldn't change a thing. I would do it again.
Awesome, great. Well, I appreciate your wisdom and your time, and we will talk soon.
Thanks, Bob.
All right, thank you. Bye.
Thank you for tuning in to Viva La Visionary. We hope you enjoyed today's episode and found inspiration in our guest stories. If you loved what you heard, please subscribe, rate, and share the podcast with fellow dreamers and doers. Join us next time as we continue to explore the limitless possibilities of visionary thinking. Until then, keep dreaming big and taking action. Your vision matters.